This video is about zero-depth vaginoplasties. And the first thing I want to discuss is what is it? So let's start with the term. The appropriate medical term for a zero-depth vaginoplasty is a vulvaplasty. So vulva is the outside of the female genitalia and plasty means to make. And so what we do in this procedure is we make the outside of the female genitalia, but not the inside. And what we mean when we say the inside is the canal. And so what that means is that there is no ability to have penetrative intercourse. So we do make the labia, we do make the clitoris, and we also reposition the urine to come out down at a lower level below the clitoris. So let's start with another question is why do people decide to get this procedure? And there's a lot of different reasons, but the first one is patients don't desire receptive intercourse. And the biggest risk to getting a full depth vaginoplasty is the dissection of the vaginal canal. That procedure in and of itself adds added risk and also a significant added layer of healing. So it's not uncommon for folks to have a much more rapid recovery, really around 30 days to when they're really getting back to normal. So in terms of patients who choose it is no desire to have penetrative intercourse. A second reason would be folks don't feel like they could continue with dilations. So dilations are required in a lifelong process of some form with a full depth vaginoplasty. Otherwise, you can lose the canal and you end up, at least functionally, with this procedure, which is a zero-depth vaginoplasty. The last reason why some folks end up getting a vulvoplasty or a zero-depth procedure is the following. They're medically very high risk. And the people who fall into that category are ones that could have had a problem in that part of the anatomy in the past. So things that we see would be colon cancer, they've had surgery or radiation. They've had prostate cancer, surgery or radiation, or they have a really significant case of Crohn's disease, which is an inflammatory bowel disease. All three of these entities can cause abnormally high risk and just dissecting out a canal. So occasionally you'll find docs such as myself or docs elsewhere that say, you know, in your situation, I think the risk is greater than the benefit of getting a full depth feminizing procedure. So that is zero-depth vaginoplasty in a nutshell. The one thing I would like to add is no hair removal is required. And generally, most surgeons require hair removal for a full-depth vaginoplasty. Thanks.